Buddy. It's been quite a few years since I've actually stood in the ring here at the Mart, usually at the back, like testing or hopefully not doing any bird management stuff. It's nice to see a lot of friendly faces out here. There's people that I know and some people that I'm not sure who are, so I'm looking forward to meeting you later today. I'm going to be around this afternoon. We're going to be having the practical part of the remote drug delivery system, and I'll be giving some tips here today with my presentation. Cindy had asked me to kind of talk about some of the health conditions that we see on pasture, and then to kind of give some practical solutions for dealing with those health problems. So the top three things that I find producers deal with over the summer: lameness, pink eye, pneumonia, whether that's pneumonia in calves and in cows. So I'll talk about each of those, and we'll talk about ways to prevent it, and then also give you some tips for treatment. I've got half an hour total. If you kind of want to run out of time or whatever, I'll continue a little bit after this afternoon. So lameness, one of the big things that I ask my clients to do when you find them out on pasture is try to figure out where is the problem. 95% of lameness issues are in foot. And that's really important to know, because if you are treating them and you give antibiotics to an animal who has no chance of recovery and for which salvage is really important, you've lost that option. And as we'll find out this afternoon, most of the medications that are most easily given on pasture have long withdrawal times. And that can be the difference between having an animal that you can salvage at today's prices, which are very high, or one that you can't actually get anything for. I've just got some pictures here of some common issues that we'll see, and these are something that if you see a lame animal out on pasture with a foot problem, it always usually helps to give them a shot of antibiotic. But remember, and this is the key thing here, is simple foot rot, swelling in between the toes, a little bit of swelling above the hoof. That responds very easily to a variety of different antibiotics. You give a shot of Oxy-LA on Monday, that animal's going to be actually looking a lot better the next day, and certainly shouldn't require retreatment. If you have an animal that you've treated and it doesn't get better, or it gets better and then it comes back, you need to look to find out what is the problem. It's not just a simple foot rot. So that's really key, is for lameness, is it foot rot, easy to treat, or is it something else? This animal here has had a previous claw injury, and so that claw is deformed and growing abnormally. If they're lame in a foot like that, that problem is really the cause of the lameness, and we need to get them in to be trained. Here's a claw that has a vertical sand crack. You can also see horizontal sand cracks, another cause of lameness. We need to trim those cracks out, and lots of times there's an abscess at the base. That's how the dirt, the mud, the bacteria, and manure get up and go up into the joint and even extend up into the leg. So early treatment and getting these animals out and treated on a tip table are very critical. Here's an animal that had a heel bulb injury. This foot here is hairy heel wart that's been treated and trimmed out, but those animals respond partially to treatment, but oftentimes need bandaging. So key is, If they don't respond to Oxy-LA or they come a year, they need to be treated or looked at more. Lameness for prevention, genetics. I think we all know there's good feet and bad feet, and certainly take a close look at your cows, your bulls. A lot of people forget that your bull is half your herd. And if you're keeping replacements off of him, make sure that he has sound structure, good feet. And sometimes you don't realize until they get to be 2 or 3 years old as far as what kind of foot problems they might develop later. But really pay a lot of attention to your genetics. I find that my clients that are very picky with their bulls don't have foot problems. They don't have foot problems in their replacement heifers. Preventative trimming would be for cases of an animal you want to send them out to pasture, but you just don't want to get rid of them, and you want to make sure that they don't have any health issues. Certainly look at that, but you definitely don't want you having a herd of animals that you need to trim. And price is right, certainly look at culling. As the previous speaker was just talking about, nutrition, very, very important for prevention of not just immunity problems, not just reproduction, but certainly foot health. And I just threw in about vaccination. There is a vaccine available for foot rot called Fusogard, and it's something that I do recommend for bulls, particularly if you have pastures that may have problems with foot rot. Those are ones that have a lot of boggy type soil, water, that type of thing. But certainly I would encourage you to consider vaccination as a prevention. Another common health problem that we see out on pasture is pink eye. And you may have just a few cases, or what I find typically for pastures is that you have an outbreak. And you might have an outbreak in one pasture, or you might have an outbreak in multiple pastures. And the key thing I'd say is discuss your outbreak problems or your issues that you're having with your veterinarian. Patterns follow. If it's one pasture, sometimes it's just whatever's happening in that pasture. Flies, dust, wind, maybe it's a pasture of first calf heifers, maybe poor nutrition and deficiency of vitamin A. So really look closely at finding out what the underlying problem is. But I have this slide here because it's really important to also look at the pink eye that doesn't respond to treatment. Because this is another thing. Pink eye does respond very readily to a variety of different antibiotics. Usually Oxy-LA is the common one. But if it doesn't, then you need to know that it could be cancer eye. The key thing with pink eye, and that's the case, or the eyes on the left here. Notice that the eye, or the pupil part, the middle black part, is hazy. Not this one at the bottom, but these two here. So haziness. There's also some blood vessels that are more red on the white part of the eye. And this case here is more advanced. It's very active. And so you see it's bright red, but it's involving the whole eyeball. Down here, this is a case that is more advanced, and the eye actually has started to ulcerate. And so that top layer of the eyeball is gone, and you've got this yellow pussy-like material here. And sometimes these eyes will bulge out, like they'll look like they're about to rupture, and they almost are, because you're at one layer left before that eyeball will bulge out and rupture. So you definitely want to treat them or try to get them early on. One of the most common symptoms that you'll see with pink eye is a runny eye, tearing a little bit, holding it closed. And so that's kind of where you may notice it. You may have one eye affected, often two eyes. But the other reason for having a runny eye is your cancer eyes. And here are some cancer eyes. Notice that this eye, probably not going to be runny, but it's nice and normal looking for the black pupil part. But there's this whitish tissue on the outside part of the eye. If you think of the eyeball as a clock, we'll see some cancers start at the 3 and the 9 o'clock position. And all it is just a little white mass there. It starts out tiny, and then it gets bigger. Here's another one where that mass has started out tiny and it's getting bigger, but it's starting to interfere with the function of the eye, and now that eye is starting to get cloudy. And I found that these will get confused with pink eye. But remember, pink eye never has a spot on the outside part of the eye. It has the problems in the middle parts of the eye. Here's a cancer eye that has a mass on the third eyelid, which is the eyelid on the inside corner of the eye that comes across. And so if you see masses or lumps, then you need to check and see whether or not that's cancer. And with today's cell phones, you can zoom in up close. I get pictures all the time. What do I do with this eye? And I don't mind if people text me because we want to treat these early. One thing I can say, I've been practicing since, the 1900s. I graduated in 93. And I have found that cancer eyes are getting more aggressive. We see cancer in Black Angus, in red-faced cows. It's not just a Hereford disease anymore. And so no matter what breed you have, you do need to be checking for cancer eye. The other thing that we also see too is that we're seeing cancers developing underneath the eyes. A common area would be underneath the lower eyelid, where it just looks bulged out. These animals have tearing eyes. They're holding them closed, so there's something wrong with that eye, and you need to get it checked. Check your eyes twice a year. Prec testing in the fall or at weaning time if you don't prec test, and then at calving time. Because you may not see the cancer in the fall, it'll be there in the spring, it'll be a mess and maybe not treatable in the fall, the following fall. So you gotta watch these guys. So pink eye prevention, if you have problem pastures, long grass, flies, there are some vaccines that are available. Pink Eye Shield, MaxiGuard are two products. Vitamin A deficiency or marginal vitamin A levels have been attributed to outbreaks of pink eye. And I've seen that where you have one pasture having a lot of problems or a herd problem or multiple animals in multiple pastures in an operation are affected. Certainly then I would suggest that you screen and check for vitamin levels. There's many different types of fly controls, fly tags, oilers, Altosa in the minerals, so many different options for fly control. I know it can be very, very frustrating, so I suggest to producers to reach out with your neighbors, other people in the area, see what's working best. Currently, right now, I know some of the medicated minerals have been really helpful, and the oilers. Fly tags, great option. They only last for about 6 to 8 weeks. So the trouble is you have to put them in before they go out to pasture, middle to end of May, and when you need them, which is usually end of July and August, they're wearing off. So not as ideal. Pneumonia, that's another common issue, and certainly it's been more of a problem this year for some clients, depending on the dust. I've done some postmortems on calves, and when I opened up the lungs, opened up the airways, there's been mud in those airways, like a lot of dust. The big thing with pneumonia is it's hard to find early on. And when we're looking at treatment, the best success we have for treating is to get them early. And that's why knowing what a normal animal looks like, being able to watch animals from a distance, seeing how they hold their head, how they walk, do they keep up with the group. I would encourage you to just sit on the fence, sit in the truck, sit in the side by side this summer, and just watch your cows being cows and knowing normal. And when you know that, then you can be you've got more skill to know what's abnormal. So the big thing too is that I find most people are watching for is a little bit of nasal discharge, maybe a slight cough, but head a little bit lower, neck outstretched a little bit more, moving a little slower, maybe a little bit wobbly. Those are all symptoms of early calf pneumonia. I don't want to go too much into the prevention. That's something you can discuss with your veterinarian, but many different prevention options. One thing that I can say is that your cows need to be vaccinated, even when you have a calf pneumonia problem. And why is that? Because those cows then can pass that immunity on to the calf through the colostrum, and their immunity is stronger. There's less shedding of the viruses and bacteria that cause pneumonia. There's no such thing as a closed herd when it comes to pneumonia in cattle. And the reason is that they carry those viruses and bacteria naturally in the back of their throats. And that's why if their immune system breaks down, or there's a lot of dust and environmental pressures, mixing, overcrowding, that type of thing, then it spreads easily between them, even when your herd is closed and you're not bringing new animals in. So keep them vaccinated. Calf pneumonia depends on when you're having problems. And the vaccine programs that I develop for my clients are varied. We look at, are they having pneumonia problems within the first month of life? Are they having problems after they go out to pasture at 2 months? Are we seeing problems after weaning? Then we look at how can you deal with these problems? What works for people? And we will tailor the programs. But there are a number of different options available. Some of them have different bugs included with them. Some of them are indicated for young calf use, some of them for older calves. There's a variety of different combinations. So certainly reach out to your vet to discuss what program would work best for you. This slide here just talks about the animals that don't fit into the lameness, eye problems, pneumonia. But you know, they're losing weight, calf's not doing well, and what I encourage you to do is just take a look and see, if you bring that animal in, what are the things that can go wrong? And in cows, say, that have just calved, that are sick, well, that's when we can see problems like mastitis. They're just starting to milk. Metritis, which is a uterine infection, just had a calf, may not have cleaned. That calf left their abdomen. There's a lot more room, things shift around. That's when we can see scar tissue from hardware and start to show up. We can see flares with heart disease and that. So be aware of what production stage they're in and what different types of health problems can occur. Again, be prepared to pull those animals in, give your vet a call, and discuss what's going on. Diarrhea, weight loss, probably one of the most common problems we see or reasons is Johne's disease. And that's a disease that's kind of like the iceberg disease. For the few cases that you might see in your herd, there may be a lot more cases. No treatment for that. Figuring out if you have a problem, particularly if you're a purebred herd and you're selling breeding stock, very important. Mastitis, certainly we've been seeing a lot of cases with that. I think with the price of calves, we've got some older cows that maybe have been kept just to try and get another calf or two from them. And we've seen calves starving. We've seen blind quarters. We've seen abscess in quarters. So we certainly want to get those treated. Bull problems, penile hematoma, swelling of the penis, corkscrew penis. Penis is corkscrewed when they're trying to breed. Watch all of those things and certainly make sure that you make the right treatment and management decision when deciding what to do with them. I don't know how many people have given Oxy-LA to a bull with a swollen penis, and that doesn't really help too much. End of the season, they're now going to have to hold them for 2 months before they might have the option to ship. Lump jaw, wooden tongue, that's something that does come up. If you're seeing a lot of cases, causes can be due to coarse feed material. If it's in a pasture situation, going in and eating bulrushes and sharp grass and that type of thing, we can see outbreaks of that. And in calves, we can also see a lump jaw, wooden tongue, laryngitis, which is inflammation of the larynx. And those calves have a lot of trouble swallowing. Their throats are really sore. Dehydration can occur. And it's often due to Haemophilus in addition to coarse feed materials. So definitely watching out for those things. And if it's new to you or you're not sure what to do, certainly don't hesitate to call. So this slide here, what to do when your sick or lame animal doesn't respond. And I just, I've kind of covered that already with my talk, but don't just keep treating them with antibiotics. And I know we're busy in the fall, we're busy amputating claws. Sometimes we have no treatment options, and often the history is, I've treated this cow 6 times with Oxy-LA and she doesn't get better, she gets better and it gets bad again. So make sure that you find out what the underlying problem is when you're treating. Treatment on pasture. Your 3 options are basically a handling facility, you're roping the calf using a calf hook, maybe roping the cow, and then we'll talk a little bit more in depth about the remote drug delivery systems that are available today. And I would say that for us in Manitoba, there's certainly not near as many people who rope as out west. We have different smaller pastures often, and maybe pastures that are a little bit more accessible. I do see a number of handling facilities in the pasture, particularly for those that are calving. That makes it a little bit easier, but sometimes you have to look at minimizing stress. And that stress on calves, cows, sometimes it's not that easy to chase them up. They get to know exactly what you're doing after you've been doing it a few times. So I think that the seminar this afternoon and learning about darting is something that can all benefit from. Certainly, my comment with the remote drug delivery devices is I think it's great. I know the Canadian Veterinary Medical Association, if you look at the website for the National Association, tends to be rather anti-use of these products and devices. And it's not that veterinarians are anti-use, it's just that there are some things that we need to keep in mind when we're using these treatment options, and knowing when to do it, why you're doing it, and then also look at maybe trying to manage and minimize the need to do it. This algorithm came from the Beef Cattle Research Council website, and as I had mentioned before, it's an awesome site. And I don't know if all of you are been able to access it, but absolutely everything on that site I've found has been really helpful, very user-friendly, and this algorithm is bang on, in my opinion here. So when should you consider using remote drug delivery? Do you have an accurate diagnosis? We talked about that already. Make sure that you're treating the disease that you think you are so that you're using the right drug and that you're doing it in a timely manner. If you know that it's the right thing to do, then as we talked about before, moving those animals to a handling facility allows you to more accurately give that drug in the correct spot. Pretty much all of the medications that we're using in beef production today are licensed for subcutaneous use under the skin. Why? It's more tissue friendly. The pharmaceutical companies have told me that they are not ever going to be able to license something for use intramuscular in a larger volume. So it's subcutaneous. And that can create some dilemmas when we're using distance medications. So if we can access a handling facility, it is best. But we also talked about, is it in the animal's best interest to bring them to a handling facility? We need to look at that. We also have to look at logistics for our clients. Everybody's short of help. Everybody's short of time. People are trying to get so much done. Feeding, crop, haying, you name it, plus they're checking calves and calving cows. So if we can do something immediately as soon as we find an animal sick, that's best. I also talked about early treatment. Of course, we all know that early treatment is important for success at treatment. If you miss pneumonia by 12 hours in the feedlot, you have a chronic animal in many cases. It's the same thing out on pasture. And you knew where that calf was at 10 in the morning. It might not really be in that area by 1 in the afternoon. So being able to access right away is very important. Crowding spreading disease, very important for pink eye. Pink eye is highly contagious. Flies spread it very, very readily. The secretions rubbed on fences, gates, and in your processing facility can spread it. So definitely we don't want to crowd animals in some situations. Injecting. And I'm sure that this chart has been seen by most everybody here. The only place that we really should inject is in the neck area. And that is the most ideal. Some of our handling facilities, that's a real challenge for them because of the way the facility is, maybe no neck extender and that. Maybe you're having to give injections for multiple days, so you do need to move them around. Multiple injections means a hand's breadth between injection sites. You need to be aware of that when you're injecting. Using the appropriate size and length of needle. Large animals, longer needles. Subcutaneous injections, shorter needles. Needle size, generally 16 gauge, is the best one for use for injecting cattle. 14 gauge, I know people have used that with some vaccines, especially the thick ones in the wintertime, and that gauge is too much. The vaccine can leak out, but also it allows dirt and water and moisture to leak in, so we do see more tissue trauma with that. So stick to 16 gauge. Follow labels for route of administration. We talked about subcutaneous. Some products are also licensed for use intramuscular as well, but read the label. A maximum of 10 mLs per injection site as per the label. And that's really easy with the remote drug delivery devices because the dart sizes are 10 mLs for max. Change your needles regularly. And if you do end up breaking a needle, record that animal. And my advice is to not ship it and to just process it for your own use. A few years ago, it was Garth Jarvis, and if any of you know Garth, he has had his own abattoir, right? And he had a needle break. Marked the spot, marked the cow. She was butchered about 6 weeks later. and the needle was in the neck, left side, and he found it underneath the belly, sort of ahead of the udder, over on the right side. So it can travel. It just moves along underneath the skin. So it's virtually impossible to find. So a few tips when darting. Practice makes perfect. The targets, which I understand we'll be doing this afternoon, really, really important. Get used to also knowing what your ideal distance is. Not shooting from farther than 60 feet, ideal is 13 to 30 feet. When I reached out to a couple of clients that have been using the darts for a few years and asked, what are the pitfalls, what are the things that you would pass on to people learning, and they said that just practice your distances, know your distances, and wind, always account for wind. All this wind that we've been having, is virtually impossible to dart an animal accurately. But do your hunting when there's less wind. Neck only. And that's important because if you're trying to dart, if you dart other areas on the animal and you're hitting bone, darts don't do well hitting bone, they just bounce off. But the other thing that happens too is that you damage the lining of the bone. And a bone lining injury, it's called a bone bruise or periosteal bruise, will last for 8 to 12 weeks. That's how uncomfortable it can be. And you really want to get to the neck. Remember that we have to space our injections at least a hand's breadth apart. Pretty hard when you're shooting from a distance. So 1 dose per side of the neck. Moving targets don't work very well. Have the animal standing quietly, broadside, facing you so that you can get that dart in fairly perpendicular. Now, the drugs that we use for in the remote drug delivery system is the ideal would be get it all in with 1 dart. Certainly 2 darts maximum for cows and bulls. And you want a product that is relatively less viscid, that means less thick. So it injects fairly easily. There's really not too many antibiotics that are suitable for a remote delivery system other than the macrolides. That is a drug class that is low volume because the dose is low. 1.5 cc's per 100 pounds is for Micotil, 1 cc per 100 pounds for Zuprevo. Zolaris is Draxin, 1.1 ml per 100 pounds. So these 3 here are the macrolides, and they are probably by far the most common drug that you should reach for if treating. What's also nice about them is they're broad spectrum. They get pneumonia, they get foot rot, they get lameness, just general health issues. More expensive. I'll make a special note about Micotil here. Micotil is the cheaper of the different products, but it is one that has some severe human health hazards. It is cardiotoxic, meaning that it will cause you to develop heart failure or have a heart attack very quickly. There was a case in Alberta at a feedlot where somebody poked themselves with a syringe that had Micotil. It was guesstimated that he may have injected himself with up to 0.5 cc. They were 20 minutes from the hospital. Protocol there was, you poke yourself with anything, you tell ASAP. He was loaded in the truck. He was having severe chest pain by the time he reached the hospital. He made it, which was good. 19 years old, no health problems or anything like that. But there have also been cases of people that don't make it. And if you're using Micatil, and I have several clients that do, we use appropriate, I guess, we make sure that you're not doing any needle stick, that you're loading the dart correctly. And if the people that are using it, they're the owners of the operation, and their policy is their operation that they're the only ones that use Micatil. But it's a good drug, but it does have some negative issues. Oxy-LA, I have that in the center here because it is certainly an antibiotic that is very effective, again, for treatment of pink eye and foot rot. The drug classes, I did forget to put in this presentation, but you're all aware that as of 2018, antibiotics are veterinary prescription only. And we have classes, like the drugs are classified class 1, 2, 3, 4. And that's based on the importance to human health. And the higher you go on that scale, we are not really to use those antibiotics as much. And if we can use a lower class antibiotic for treatment of that disease, we should consider using that. And Oxy-LA, liquamycin, some of the other like generic Oxy-LAs, they fall into that category. What is not as nice about them, the dose is 4.5 to 5 cc's per 100 pounds. The other thing is that they tend to be a thicker antibiotic. The unfortunate thing is there was an Oxy-LA 300, which was 300 milligrams per ml strength, so you could use a lower volume. That went on back order, and it is now discontinued. It will not be back. So we are stuck with the and my final slide here, I just wanted to also stress to you that we are all in the business of food production. And so we need to make sure that when we have animals going into the food chain, that we've done what we can to ensure their, that meat is going to be as safe as it can be. And that starts with our choices for nutrition and genetics, our choices for management, feeding, vaccines, disease control, treatments, even things like handling them, stress-free handling. All of those things go towards production of an animal that's the best quality that we can have. Anyone have any questions?
I have a question, but it might be covered this afternoon. But I'm just wondering, like, with this remote drug delivery and just with different prices and everything like that, do you see this becoming the norm within maybe 5 to 10 years, or is it still something that will take a while for people to adapt?
Yes, I'm sorry, I'm not sure.
Sorry, the remote drug delivery, do you think that that's going to become widespread in like 5 to 10 years, or will it be slower than that?
I guess I think it depends on who you talk to.
But I would say I think it